Hello, everyone. This is Dr. Suchismita, welcoming you all to the Mathematics of Diseases, where we explore the physics and metaphysics of diseases with our co host and a very dear friend, Jana Reddy, who is a certified international healer and coach. Hi, Jana. Welcome. How are you doing today?
Thank you, Suchi. I'm doing good, and it's been a wonderful initiative that we have initiated the mathematics of disease. The whole concept being, we do know that in the medical science offers amazing insights into the science behind it or the physics behind any sort of a disease. And what we require at this point of time is an understanding about how we can bring in a holistic approach and to see how powerful the healing could be. We are trying to blend in and give our insights with the case studies that we have been uh, doing with the clients, with understanding about how emotion and thoughts can manifest into a discomfort in the body. Towards this, the whole initiative that we've taken is to bring to our viewers and listeners an understanding there's something more is possible apart from the medical, the knowledge and the science that we have, the kind of treatment that already continuing and it's available to us. We would like to adapt that in a holistic approach into the whole treatment and whole approach towards bringing relief to people as such. And that's a whole science behind the starting of this beautiful initiative, which we have branded it as mathematics of disease. Thank you for inviting me on this. I'm eager to share my insights with respect to therapy, with respect to emotions and how this could play out, and how this could help people to heal themselves from this deep pain. Certain diseases have been quite chronic. They've been suffering for a longer duration of time. So this is the reason behind the starting of this wonderful initiative, Mathematics of Disease.
Okay, so all the listeners out there must be wondering, why does Dr. Suchismita want to, discuss the metaphysics of a disease? And isn't her medical knowledge just enough to treat a patient? Well, to answer that, let me start with a very personal experience. I was diagnosed with bronchial asthma 15 years ago. I was on inhalers, antihistamines, steroids, but none of them gave me a complete relief. Instant relief, yes. Complete relief, no. So my family was worried and they took me around to various Ayurveda practitioners, homeopathy practitioners, acupuncture, Siddha medicine, salt therapy, and whatnot. And then everything gave me slight relief, but like I said, not complete relief. So, and then it just went on for years. And then one day in med school, a very close friend of mine, she suggested I explore therapy because a very close family friend of hers had undergone therapy with a similar condition. And apparently, they explored a childhood episode. And after that, he never had an episode of asthma. That kind of triggered a thought, but it stayed in the back of my mind. I mean, it didn't approach. I mean, I never thought I could actually go into therapy. The logical side of my mind didn't really accept it. So I was like, okay, yeah, whatever, good suggestion. And like they say, life comes about in a circle. I was introduced to therapy a few years later, and I started working on myself. And it's 5 years today, and I haven't had an asthma attack. I don't use my inhalers, though I keep it with myself all the time. But yeah. And then at that point, I realized if this could help someone like me, I'm sure there's somebody out there who it could help as well. So that's how Jana and I just decided to share this with the world outside. So, Jana, do you want to add something else?
Of course, every disease has a manifested emotion and a thought. So no disease just just pops out just in the body as such, and unless until there is a reason behind it, or there is certain triggers in the environment that we talk about. So which we're going to share it with one of the case study that we have picked up today about sciatica nerve, where I'm going to share about how thoughts and emotions have a big role to play, and how it manifests into this chronic pain that keeps coming out as such. I shall share my inputs, once we keep discussing more about the sciatica nerve.
Okay, so like Jana already mentioned, our topic for today is sciatica, which in medical terminology is called as lumbar radiculopathy or the pinched or the compressed nerve. Statistics say 10 to 40% of the population suffer from it, and mostly men experience it 3 times more than women. And it's common in adults between the ages of 40s and 50s. So, what is sciatica? Well, it refers to the pain that radiates along the path of the sciatic nerve, causing pain from the lower lumbar vertebra down to the thigh and calf, and sometimes to the foot and the toes. So it's a very sharp, excruciating pain, and then sometimes accompanied by burning, tingling, and muscle weakness. What are the causes? Well, the sciatic nerve is pinched mostly by a herniated disc in the spine, or probably if there is an overgrowth of the bone on the vertebra, or sometimes even diabetes. So, what are the risk factors? One, age related bone changes. Number two, obesity. Occupations like heavy lifting, prolonged sitting, and like I mentioned earlier, even diabetes. So, how can you prevent it? First, exercise regularly, maintaining a good posture, and also using good body mechanics. Like if you're standing for too long, you could rest one foot on a stool from time to time. Or let's just say you're lifting something heavy, you could bend your knees and hold the load closer to your body. So that way, the mechanics of the body is balanced. And one more interesting aspect about sciatica, a lot of pregnant women complain about it. So what could be it? What could cause it? Most of them think it's because of the baby they're carrying and the weight issues during pregnancy. But no, that's not the cause. Uh, Mostly it is the hormones that cause loosening of the ligaments. These ligaments, they hold the vertebra together, and then they give the stability to the spine. But during pregnancy you have a lot of hormones like relaxins, and then ligaments just get loosened, and then they are not able to protect the vertebra, and thereby causing instability. And this instability gets the nerves to pinch and then cause sciatica. So, how do we diagnose sciatica? When you go see a physician, a complete thorough history, and then we go through physical examination, a few lab tests, and then your regular scans like the X-rays, CT scans, MRIs, myelograms. So, what do you advise next? Home care treatment first. They ask you to apply ice or the hot pack, take over-the-counter drugs like the NSAIDs, Tylenol. If you're allergic to NSAIDs, you take a Tylenol there, just a correction. And then also practicing stretches. And if none of this help you, you again go back, see your doctor, and then they prescribe you muscle relaxants, suggest physical therapy. Sometimes even spinal injections are given with steroids. Let's just say none of this work. What happens next? You go in for surgery. So this is basically the medical management. A simple backache can actually lead to a surgery nobody would have thought, but it is what it is. So let's just hear from Jana what could be a holistic approach for the management of this disease to decrease the pain, suffering, and ease the life of people. Over to you, Jana.
Thank you for sharing the beautiful pathology and the physiology about this sciatica nerve problem. Now I'm going to add up something more on the emotional aspect of it. How sciatica nerve or the pinch nerve problem that we're discussing about, how does it manifest in the body? So one is the main important aspect of it when somebody feels the emotionally and physically is invaded by your own family members. Sometimes we come to a family system and there is a right to privacy or your boundaries are not respected. When you feel humiliated, when you feel there is a disconnection from your territory and also the identity, this is one of the reasons. And there also what could be one of the emotion that could be running, that and if you feel that you are a scapegoat in the family, like we all have one person in the family that would be taking the the burnt of everything that happens in the family. Either it's over responsibilities, or taking the blame, or taking more than necessary, being a giver or try to be a pleaser, sort of an uh, attitude that sometimes we all pick it up as such. This is one of the reasons. And sometimes what happens is, when you're unable to express anger, because sometimes when you feel your boundaries are basically are bypassed, or it's violated, so
Yeah.
you have certain amount of an anger which you're carrying it within you, that could be causing this kind of an emotion, or this could cause up a pain in your body, manifest in certain forms as such. The one other reason that can happen is there is a epigenetic reason. Sometimes we know that our genetic codes that we carry from our ancestors, that we might, if they feel there is some amount of intrusion in their boundaries, and they carry that emotion, sometimes out of loyalty, we may or might pick up those qualities and then try to manifest in the body. And one more important aspect is, when there is a birthing trauma involved, or the fertilization challenge, like Suchi, you talked about, that a majority of the women during pregnancy are going through this particular challenge. It's
Yes.
not to do with the weight of the baby. It's because of the stress involved during the fertilization. The one is their own fertilization,
Interesting.
when they were conceived, and when they are conceiving it, they also could be carrying this particular challenges, because becoming a mother, becoming a parent is a very big responsibility for many. They're not prepared emotionally and mentally for that. So there is a physiological changes that is going through in the body because of the changes. There's a new life coming into picture. Of course, there could be parental pressures, or societal pressures. When certain cultures expect the mothers, the wives of the family, or the mothers or the daughter-in-laws of the thing, they conceive a child as quickly as possible. So there's a constant pressure that keeps coming out. So these are some of the emotional aspects, or the mental aspect that are involved in these kind of challenges. So there are a couple of case studies that I would like to share it. One was that we did a therapeutic approach, a couple of years back, when she was an yoga practitioner. She used to be practicing yoga, trying to do all the relevant stretches. The yoga is all about stretches, stretching the body, elevating the hip movement, trying to expand, doing all sort of things, and frequently going to physical therapy as such. So in one of the constellations, when we're trying to realign the energy with the maternal side, there's an realignment that's going around. That resonance helped her to immediately, ease that pain in the sciatica. Like it was like a
Ah,
wow moment. It was like a, she was not in part of the her own constellation. She was doing for somebody else, but the insight that she got it, was like a moment of enlightenment. This happens during that time. And recently I was working with a client who's also going through a similar sort of an experience about. So what we realized was that her mother, when she was carrying her in a womb, the first 2 years, because it comes from a traditional society wherein she did not conceive for first 2.5 years of the marriage. So there's a constant pressure in the family that something is wrong with the daughter-in-law, something she's not conceiving it as such. The mother was going through immense challenge with respect to conceiving a child, and she's been carrying a lot of fertilization trauma there as such. And what happened, the daughter carried that out of loyalty of the mother, that mother has gone through this fertilization challenges that she has gone through. Out of loyalty, out of think that she has to repay it back, there's a loyalty game that goes around, and she was the elder, first child. She was the first child of the family, so she was carrying all the emotional and the mental aspects of what the mother was carrying it out as such. So there could be a different reasons and approaches to this, sciatica nerve. What I would suggest, apart from the conventional medicine that you're continuing, please explore these aspects also, the emotional and the mental aspects too, so that you could bring in a beautiful holistic approach, to use the conventional medicine. Could be a physical therapy, could be your usage of certain amount of chiropractic realignments, readjustments, if necessary, in using of certain sort of a painkillers. Also using these therapeutic approaches will help you to ease your pain, and then you'll be able to maintain your life in a much better way. This is what I would like to add up. Like I'm also adding up to it, it is not the only reason that I have discussed here. There could be other reasons that could be there. But definitely, when somebody is going through this, and if you could, approach us and, send us a message on the Instagram, and then talk about your condition, and we can dig deeper into the emotional and the mental aspect of it. So, and then bring in a more holistic approach of, trying to connect to those aspects, and give you a therapeutic approach, trying to get the best of the both the worlds. Why not? When you get the best of
Absolutely.
medical
Why
science,
not?
why not use that thing? The knowledge is available. You know the life, you know better about your life than anyone else. When these questions are answered and you're able to get some insights, the best of the both are available to you, and then you can make your life more manageable and in a much better space as such. That's what I'd like to add up here.
Like a complete well-being, like the WHO defines,
Divines.
health is the complete well-being of physical, mental, emotional levels. So a complete balance. So that'll probably help you recover fully. So yeah, thank you, Jana, for sharing. It was a wonderful discussion. Do you want to add something?
Like I said, we are not trying to, as a disclaimer, we're not trying to replace or change any of the conventional methods that you're already using it out. But what we are trying to tell you is that, you could explore the other aspects of, this, condition that anyone is going through as such. Look at this, and there are quite a few points that could be coming up here. What is relevant, you could pick up on that line. I have spoken about few of them. Could be something more that could be coming up in respect to sciatica. So when you dig deeper, you will be able to resolve these issues and live a better life. That's what I would like to tell. From a time, from the physics, you will get to the depth of the metaphysics and bring more understanding, and then, from that, the transformation, so that, this condition that you suffer, or anyone is suffering, is a big relief that keeps coming out, and you can lead a better life. The whole idea is to bring in that, a better life concept as such. Why not have the better life?
Thank you. Thank you for your wonderful insights. I'm sure everybody found this very interesting, just like I did when I was initially exposed to it. So stay tuned. We'll come up with some other disease in the next episode. Ping us, drop us a message if you want us to discuss a particular disease, and we'll be happy to do it for you all. Take care. See you all in the next episode. Bye bye.
Thank you, and then keep watching the space on our Instagram page, which is Mathematics of Disease. Please like it, and share it with people around you who would, benefit from this. This is our, contribution to the society, so that, we can bring in holistic approach and a better well-being for others. And also, we would request you also to share this insights, share your own inputs about, what you'd like to listen from us. We could definitely add up, our own insights, our own experience, bring in the therapeutic knowledge and the case studies that we might be already having for quite a few issues with conditions that we might be having. It definitely, we'll keep making this program more scientific and approach up, also more emotional and more, coherence. That what I would talk at. I would like to bring in that coherence, so that you can lead a better life. Thank you. We shall see you soon with one more episode, and with one more insight and more understanding about it. Thank you.